Welcome to the Health and Beauty channel. Today, we will discuss the topic of thyroid disorders. Can thyroid nodule be treated? Are there medications to shrink thyroid nodule? As you may know, although the thyroid gland is small in size, but thyroid hormones play a crucial role in the body's endocrine and metabolic functions, as well as other normal bodily activities. Thyroid nodules or thyroid tumors are very common conditions associated with thyroid disorders. Therefore, information about thyroid nodules or thyroid adenoma is often incomplete. In this video, Health and Beauty will provide all the necessary information about thyroid nodules or tumors. Thyroid nodules or tumors are localized lesions within the thyroid tissue. They represent a specific or abnormal growth of thyroid cells. In terms of classification, thyroid nodules or tumors can be divided into two types. The incidence of thyroid nodules or tumors is higher in women than in men, with a ratio ranging from 4:1 to 9:1. With benign thyroid nodules, you can live with them throughout your life without worrying about the presence of nodules in your body. However, in the case of malignant thyroid nodules or thyroid cancer, the proportion is very small, accounting for about 1% and falls into the high-risk group, while the remaining 99% have a very good prognosis for treatment. Therefore, it can be said that thyroid nodules are not dangerous, and in the case of malignancy, treatment also yields very good results. Currently, the best and most effective method for screening thyroid nodules is thyroid ultrasound. The most effective and highly specific method to date is fine needle aspiration of thyroid cells to evaluate whether the nodules are benign or malignant. Assessing the risk of thyroid cancer will depend on the results of thyroid ultrasound and fine needle aspiration. So what are the results after thyroid ultrasound and fine needle aspiration? First, with the results of thyroid ultrasound, doctors will assess the nodules using a scoring system called the Thyroid Imaging Reporting and Data System, TIRADS. For cases with a TIRADS score of 4 or higher, it is important to take note of it, as this ultrasound result will serve as a guide for the clinician to decide whether a fine needle aspiration of the thyroid cells is necessary. After obtaining the results of the fine needle aspiration, you can refer to it to determine your risk of thyroid cancer. Typically, specialized pathologists will evaluate the fine needle aspiration results using the Bethesda system for reporting thyroid cytopathology, which consists of 6 categories ranging from 1 to 6. In cases where your Bethesda category falls within the range of 4 to 6, the likelihood of cancer increases gradually from 15% to over 95%. So, do thyroid nodules require any dietary restrictions? The answer is that individuals with benign thyroid nodules that do not affect thyroid function, meaning they do not have hypothyroidism or hyperthyroidism, do not need to follow any specific dietary restrictions. Now, let's talk about the treatment options for thyroid nodules. For benign nodules, you have 2 choices. The first option is to live with the nodules because benign nodules do not have any impact on your health. The second way, you can completely use the high-frequency wave burning method to destroy the nucleus while preserving the thyroid gland. Alternatively, you can undergo a surgical procedure called a partial thyroidectomy, which involves removing a portion of the thyroid gland. In the case the size of the thyroid nodule is still small, as well as there are no signs of capsule rupture or thyroid gland metastasis, you can completely treat it with high-frequency wave ablation or partial thyroidectomy. However, if the thyroid cancer has started to show signs of metastasis or capsule rupture, then you will definitely need to undergo surgery to completely remove the thyroid gland. Currently, there are no medications, functional foods, or any other measures that can help shrink or eliminate thyroid nodules for everyone. It is important not to believe in any advertisements for functional foods or methods that claim to eliminate thyroid nodules without intervention. Therefore, after watching today's video clip, everyone should have a certain understanding of the symptoms of thyroid nodules or thyroid adenoma. This knowledge will help individuals evaluate and adopt an appropriate approach to managing their thyroid nodules or thyroid adenoma. If you have any questions, please comment below the video clip for further consultation. Finally, I wish everyone happiness and good health. If you found this video helpful, Please like, share, and subscribe to the Health and Beauty channel to stay updated with more videos on medical topics and other healthcare knowledge.